treatments that will get you brighter eyes and smoother skin. Here to fill us in on these life-changing treatments, we welcome Dr. Campbell Waldrop with the MedSpa at IQ. Welcome, Doctor. How are you?
Thank you for having me. I'm good, thanks.
Thank you for being here with us. Doctor, first of all, what is BBL?
So BBL is a light-based treatment that you use to treat brown spots or red spots in your skin. And we put special filters on the light, and then it really kind of targets those pigments in your skin to help them kind of come to the surface and slough off.
Okay, and then that's like for the hands, the ones that we see, those little dots,
for the hands,
right?
yeah, but you can also do it for the face. You can do it for a lot of people, the neck and the chest. And we live in such a sunny place. There's a lot of sun damage, and it just helps kind of get rid of some of that sun damage. A lot of people have a condition called rosacea, which is some redness in their face, and it can help tone down that redness quite a bit.
Oh, even for rosacea, that is something that important people should remember as well, because, you know, you just think of the dots, but, you know, people suffer from that on their face.
A lot of the red, and this machine, it really helps that skin just kind of look smoother, and it feels smoother, and the texture is just a lot better. It's really a wonderful treatment.
And Doctor, at what age do you recommend for people to start getting this treatment?
Well, I think most of the time it's when people start seeing some of the damage. Unfortunately, they've had years of getting the damage, but a lot of times it ends up being in their 30s and 40s are good times to start. I think it works better in prevention than it does in helping keeping that skin nice and glowing. But a lot of times we'll see people once they've started to notice a lot of the brown spots and the red spots.
Yeah. And usually at what age do people kind of start seeing those spots?
I think it's oftentimes in their 30s and 40s. There are people who've taken better care of their skin, and so they get a little bit longer time frame before they see it. But there are people who, you know, being active and being out in the sun, especially younger, they'll have a lot of sun damage at relatively early ages.
And of course, at your center, you guys also have another treatment, right? The lower eyelid rejuvenation. What is that exactly? So
a lot of people talk about it as a lid lift. I specialize in the eyelid surgery, the upper eyelids and the lower eyelids. And so people talk about the bags under their eyes and things like that, or hooding of the eyelid. So those are surgeries that are really interesting because they really kind of keep people looking themselves, and it's also something that's almost as interesting to men as it is to women. I'd say almost half the patients are men, which sometimes surprises people, but the under eye area, it's a cosmetic procedure. It really just helps smooth out that area, make it just look younger and fresher. So doctor, you recommend for people that have like those bags under the eyes, they could get this rejuvenation thing, right? Yeah, absolutely. And most of that is genetic. It's their mom had it or their dad had it, and so some people get them at an earlier age, but most of it's just that kind of a thing that they've had it from the parents. Wow. And what is the cost for this treatment? So the cost of doing the eyelid surgery is $4,700, and that's the whole fee. That's my fee. That's the anesthesia fee. That's the operating room. So it's the out the door cost. Yeah, it's really quite reasonable for what you're getting done. Definitely, because if you're getting everything done, and usually when you get that done, doctor, does it last, or how does that work? I tell people it's the most permanent option we have available. So yes, it does last. We're taking the fatty tissue and the extra skin that we take out, it does not grow back. And then besides those services that you have, those incredible services, what else do you guys offer? So we have some skincare products, and we also do a lot of Botox and fillers, and so those are the other things. I've been here 16 years, and I've really tried to focus on things that, there are a lot of things that come and go, but these are products that I've really found have stood the test of time and really offer people a lot of value. So that's why we offer them. Definitely. And of course, the holidays are just around the corner. What kind of special deals do you guys have going on? So for our skincare right now, we have a 15% special on the skincare line that we carry, and we'd want to check your skin and make sure you're a good candidate. But they're really nice. They're medical grade products, and they really do a lot for people's skin. And of course, doctor, I kind of want to go back to the whole spot thing that you have going on, because there's a lot of people here that live with spots, because like you said, it's really hot here. Is that genetic as well? Or? There are conditions that can be genetic, but most of it is just sun stuff. And I've shown this before. I'm happy to do it again, but I've done one hand and I haven't done the other. And I know you haven't seen it, but the audience has, I think, seen it before. Let's show them again. They need to see this. But so this has been the treated hand, and this has been the untreated hand. And so it's kind of been 5 years of doing it, and you can really see a significant long-term difference. You definitely can see that. Yeah.
Oh my, and that's what, 5 years you said?
That's been 5 years. Yeah, I started doing that in July of 14.
Oh, 14, and then this one you still haven't gotten
I still haven't done it, yeah.
Wow, no, that is incredible for people
Yeah.
to actually see that. And for the people that are interested and watching, where could they call to make an appointment?
So they can call our office. It's the MedSpa IQ, and you can look at it online. I'm not sure which numbers they have coming up on the screen, but there's also 256-8490, or the main number is 486-2000.